Hello my study buddies, today we're going to be looking at the management of DKA. So we need to understand that when you're dealing with a DKA patient, there are two parts that you have to take note of, and the first one that you have to take note of is the general resuscitation. Okay, so general resuscitation of that patient. And then the second part is the specific management itself. So MGT is an abbreviation for management. Yeah, so when you're dealing with the general resuscitation, we usually anyway, we use a mnemonic that helps us to remember the components of resuscitation. And the main things that you look at when you're dealing with DKA, according to the pediatric protocols of Zambia, is that you have to look at the airway, breathing, and the circulation. Okay, these are the main components that you have to deal with under general resuscitation. So when you're dealing with the airway, you want to ensure that the airway is patent. Okay, so you want to ensure that there's patency. You want to secure the airway. Okay, and then if this patient is in a coma, and you also have realized that maybe, or you are told that they vomited at some point, or vomited, okay, you can insert what? An NG tube. Okay, you insert the NG tube and you ensure that you drain, okay, you drain whatever they had in their tummy. Okay, so you aspirate and you ensure that it's an open drainage. Okay, and then when it comes to breathing, you have to ensure that you give 100% O2. Okay, that's if their oxygen saturations are what? Less than what? 92%, right? So you give O2, and you usually use a bag and a mask if they're apneic. Okay, those are the things that you should take note of. And then when you're dealing with the circulation, which is C, you want to insert two large bore cannulae. Okay, and in this moment, this is what you'll be using, to administer fluid, and you can also get your blood samples here. Then when you're dealing with the specific management of DKA, we use the mnemonic SIPA. Okay, this is a mnemonic that you use to help you remember what you have to do for your patient. So S is for solutions, which is fluids. I is for insulin. P is for potassium. A is for antibiotics. Okay, these are the things that you give to your DKA patient. So when you are giving fluids, remember in the other video, if you haven't watched that video, please do. Okay, in that video I talk about how to calculate the fluids. So when you're dealing with fluids, you give 0.9% normal saline, and then later on you will switch to DNS, Okay, this is once the random blood sugar drops to 12 millimoles per liter. Okay, this is when you actually switch it up to DNS. Okay, so the fluids that you give is 0.9% normal saline. And in the other video, I actually teach on how to calculate these fluids. Then when it comes to insulin, you give 0.1 international units, okay, per kg, per hourly, continuous, IV, which is intravenous infusion. Okay, this is how you handle the insulin. When you look at the protocols, they'll actually tell you how to go about it if what can I say? If the glucose levels are dropping very rapidly, there's a way that you deal with it. Okay. Then apart from the insulin, you also deal with the potassium. Okay, so you give potassium chloride, okay, which is 10 to 20 millimoles. Okay, so you give 10 to 20 millimoles, and what you do is that you put this 10 to 20 millimoles in 500 mils of normal saline, okay, like in each 500 mils of normal saline in the first what, 24 hours. Okay, so that's something you should take note of, that when you're dealing with the potassium, which is potassium chloride, potassium, you give 10 to 20 millimoles. Okay, and this 10 to 20 millimoles is placed in the 500 mils of normal saline in the first 24 hours. Okay, but then there are contraindications for this potassium chloride. So contraindications, meaning times when you shouldn't give this. Okay, so the contraindications of potassium chloride, number one is if your patient has got anuria, meaning absence of urination, absence of urine. If your patient's T waves on ECG are peaked, okay, or if their serum potassium is greater than 7 millimoles per liter. So if there are any of these things or any of these cases or all of them or whatever is happening here with your patient, then you ensure that you don't give the potassium immediately. Okay? Then when it comes to antibiotics, you treat present infection accordingly. Okay, so we know that one of the precipitating factors of DKA is actually infection. Okay, so because of that, you want to ensure that you give antibiotics in case there is that infection. Okay, so if it's an infection that's causing the DKA, then you have to find out what infection it really is, and then you have to go ahead and give your antibiotics accordingly. Okay, otherwise this is the management of DKA. Thank you so much. If you have any questions, please do post them in the comment section, and if you have anything to say, do so. Please like, share, subscribe, leave a comment. I really appreciate that. Thank you so much. Till next time.